Hello, my beautiful nurses. Thank you for coming back and watching my YouTube channel. I really appreciate your effort when you share it with your friends and like the video. It gives me motivation to make more YouTube videos. So without any further delay, let's get into the video and talk about our today's topic. So today's topic is about Osce medications in the implementation station. What kind of medications you're gonna get, and what are the medication you need to make yourself aware about. So without any further delay, let's start the video. As I mentioned earlier, we're gonna talk about all the medications that we need to know for the exam purposes for the Osce station, clinical station, its implementation, and also when you get medications like a skill like IM injection or subcutaneous injection, what kind of injections and what kind of oral tablets you're gonna get. So let's talk about I have categorized them just to make it easier for you guys. So let's talk about it. The first of all, the first thing you need to know is about antihypertensive drugs. Think in your mind what kind of medications are there. So there are lots of medication. Antihypertensive, losartan is there, ramipril is there, losartan, ramipril, amlodipine, lisinopril, antihypertensive drugs. When you give any antihypertensive drug, what are the things you need to know? You need to know your patient's blood pressure. You need to know their heart rate. Just ask them what was your blood pressure, or if you are already given the reading, just check with the assessor. May I give, can you please tell me what's the client's blood pressure, and then the assessor will tell you what is the blood pressure, whether it's in therapeutic range or not. So before giving any antihypertensive drug, losartan, ramipril, amlodipine, lisinopril, and other drugs, as you know, there are a lot of pills there. So just keep in mind that all the antihypertensive, when you give, you need to know their blood pressure, you need to know their heart rate. So that's the first category, antihypertensive. The next one is antiemetic. Antiemetics are the anti-sickness tablets, and in the exam you're not gonna give anything like what do you call it, controlled medications. We'll talk about it at the end. All right, so anti-sickness, we have ondansetron, we have cyclizine. You're gonna ask them if they're feeling sick, if they are nauseous, or you just gonna tell them that this is your anti-sickness tablet, and it will help you feel better with your sickness. If you're feeling nauseous, it will keep it down and make you feel better. Okay, so just don't keep it long, guys. Don't make it long. You don't have that much time in the Osce exam. Just give them a brief explanation. What is this medicine for, and why I'm giving this to you, and how many mgs I'm giving. Let's say I'm giving you amlodipine 5 mg. It's your blood pressure tablet. It's for your blood pressure. Okay, so if the patient has any problem, or if if they're taking higher dose, or if they're taking lower dose, they will tell you. If not, they will be happily taking that medications. About antihypertensive, there are antiarrhythmic tablets also, just to make the heart rhythm better, or just to make it in rhythm. Antiarrhythmic. Yeah, so if there is any arrhythmias going on, if the rhythm of the heart of the patient is irregular, if they are in fast AF, if they are in atrial fibrillation or ventricular tachycardia or whatever arrhythmia, so it is emergency, isn't it? So if they are in any kind of arrhythmia, heart problem, their heart is not beating regularly, it's irregularities with the heart rhythm or heart rate or whatever. Yeah, anti-arrhythmia, to control their heart rhythm, to make it rhythmic, we are giving them digoxin, atenolol, and there is also, what do you call it, I wrote it down though, bisoprolol as well. So bisoprolol, it affects on the blood pressure and the heart rate also. So you need to know that if their blood pressure is okay and if their heart rate is okay before you giving them. And same applies for digoxin. Digoxin lowers the heart rate of the patient. So you're not gonna give them digoxin if their heart rate is below 60. If their heart rate is below 60, you're gonna hold the medication. You're not going to give antihypertensive or antiarrhythmic medication. So for the blood pressure also, as I said, for the antihypertensive drugs, 90/50 or 80/50, you're not gonna give antihypertensive drug and then because it will make their blood pressure or their heart rate more lower, so it will be a trouble for you and for your patient. So just keep in mind, before you give them any medication, any kind of medication, you need to know what kind of medication this is, and then what are the side effects and what are the indications, because patients may ask you, what is this medication for, nurse? And then you need to know what is this for. Let's talk about analgesics. As you know, there is paracetamol, ibuprofen, there is aspirin, there is what else, aspirin and codeine. So for codeine, cocodamol is the big trouble for the Osce exam, guys. So just check in your stat medication or PRN medication if they were given codeine or paracetamol before you give the regular dose. Let's say if they were given codeine before in the stat medication or in PRN, maybe the time is overlapping or something. Just double check the timing of the regular medication. When you see there is something given in the stat medication, let's say if codeine was given at 12 and then you have regular medication prescribed for 1400 hours for 2 o'clock. So codeine was given at 12, you have regular medication called cocodamol at 1400 hours. Are you gonna give it? Nope. No, we're not gonna give, because it was given 2 hours before we giving this medication. So you can tell the patient that you've taken codeine at 12 o'clock, I'm not happy to give you this medication. And then also at the end you need to code it, why you're not giving it, and then what is the reason of omitting that medication. So you need to document it, code it, and that if you watch my previous video of the if you watch the video of implementation, you will see there is a column at the end which gives you all the information. You need to write the name of the drug, time of the medication, how many mgs it was, and why you did not give, and also all the codes of the medication, that if you're not giving the codes, mostly it's like if patient refuses, code 2, if prescription is not valid is code 6, and then also like if medication not required is code 7. You will be provided with all the codes in the exam as well, so you would know, you can see from your prescription why I'm coding number 2, because patient refused the medication. You need to write the code and the reason for omission of this medication. There is also depression drugs, like for anxiety, anti-anxiety or antidepressant drugs called sertraline is quite common. Sertraline, Traline. Sertraline, keep in mind, if patient asks you what is it for, you can tell them it's anti-anxiety tablet or it's for your depression. Just give them a brief explanation. There is also medications for overactive bladder, such as mirabegron, or oxybutynin also is there. So if patient asks you what is it for, you can tell them it's for your bladder. If you're going to the loo frequently, like just to, if they cannot control, if they're having incontinence because of overactive bladder, just explain it to them. It's for your it's for your overactive bladder. It will treat the overactiveness of the bladder. We're gonna talk about is anti-hyperglycemic drugs, the medication which treat the glucose level of the patient. Let's say if a diabetic patient, the most common drugs we use here is metformin or glycoside, sometimes sitagliptin as well. So just keep in mind that these are the blood sugar tablets, and if their blood sugar is all right, before you give your patient that tablet, metformin is a long acting, but still you need to know the blood sugar level of the patient. Maybe their blood sugar is 2, and then on top of that you're giving them metformin. Whether it's long acting or not, It's long acting, but still keep in mind that you need to know the blood sugar level of the patient. Just ask the examiner, I'm giving metformin, is the blood sugar level of the patient okay? They say okay, it's in the therapeutic range, you can go ahead and give. And if they say no, blood sugar level is low, you're gonna hold it and then you're gonna write the code why you're not giving. So just document at the end. Omitted for the clinical reason is usually, I think, is number 3, that omitted for a clinical reason. So just remember your codes and then document at the end. One more thing, if you don't document, you did not give. So make sure whatever tablet you have given, sign for it right away after the patient has taken the tablet, not when you dispense it. Let's say I've taken Ramipril in my pot, in my medication pot, and then you cannot mark it. It's in your mind that I've taken Ramipril out, and then when you give the patient the tablet, patient has swallowed it, ask them, have you swallowed your tablet? They say yes. Then that's the time you need to sign it. That is the time to sign it off, not before that. Okay, because sometimes what happens, it happens a lot, you put all the medications in the pot, you go to the patient, give the tablets to the patient, and patient say, I don't want that. So what if you already signed it? If your medications are online, if you have already signed it, you're not going to take it back. You cannot do it. You cannot cross it off that time. If it's a paper version, maybe you can make a mess. But if it's online, it's not possible to go back and then remove your signature or delete it. It's not possible. So you just need to write a note that it was charted accidentally, or the patient did not take this medication, patient refused to take. So instead of going through all this big process, giving explanation why I signed and patient didn't take, just ask the patient first, let the patient swallow the tablets first before you sign it, before you document it. There's also omeprazole and lansoprazole. It comes very common. It's a protein inhibitors, and then also they help with the stomach ulcers. And so if patient asks you about omeprazole and lansoprazole, tell them. There's also prednisolone. It comes a lot in the exam. For the prednisolone, you can tell them is the steroid. It will help you deal with the inflammation or things like that. Just give them a simple explanation if they ask you about the side effects. If you don't need to remember each and everything, guys. Honestly, they are not testing you on the medication. You are not a pharmacist, you are not a doctor, you're a nurse. You need to know the basics. So most commonly side effects are like what do you call it, some people they get headache, some people get nausea, vomiting, head or abdominal pain. It's quite common to have all these symptoms with all the medications. So if you don't know anything, just tell them this, because it comes with a lot of medications. So you don't need to be expert in medications, but you need to know the indication of the medications, and then you need to know if what are the observations I need to check before I give this medication. So don't make these errors. Your pain is very, very important for you. You've got it in with after so much struggles. So don't lose it just giving one bisoprolol. Don't lose it just giving just giving one losartan without checking the blood pressure of the patient. So keep in mind, whatever you're signing for, you are responsible for that thing. Whatever you signed for, you are responsible for that thing. And also other things that comes along, like supplements, vitamin D supplements, or iron tablets, ferrous sulfate or ferrous fumarate, or thiamine, vitamin B12 tablets, or what do you call it, the other calcium tablets, calcium carbonate, for the replacement of the supplements. So the name would tell you as well, calcium carbonate for the muscles and bones and for your calcium. Obviously thiamine is vitamins B12, vitamin B6, and then also iron tablets also there. So just keep in mind ferrous sulfate and ferrous fumarate. So these are the iron tablets. Just keep in mind that if they ask you about this medication, you should know what is this medication for, and then why we're giving these supplements. Maybe they're lacking this supplement in their body, that's why we are replacing it. and then tell them the reason. Most commons are calcium and vitamin D3 and ferrous fumarate and ferrous sulfate. Next thing we're going to talk about is the diuretics. What are the diuretics? Diuretics are the things which make you go to the loo again and again and again. Especially if you are in the elderly ward, you have given to your patient, they would be complaining all the time. It's you gave me that tablet, I'm going to the toilet again and again and again. So diuretics comes like furosemide is there, spironolactone is there, and also what else? Also furosemide, spironolactone, bumetanide, and then bendroflumethiazide. It's so long name. These are all the diuretics. They make the patient to go to the toilet. And then also tell them sometimes furosemide, and for giving furosemide also you need to know patient's blood pressure, and then also that encourage them to drink more, because you're giving them antidiuretic, you're giving them diuretic, not antidiuretic, you're giving them diuretic. So just tell them that you need to drink lots of water, because you will go to the toilet again and again with these medications. Sometimes these diuretics they give for heart failure, they give to treat high blood pressure as well. So keep in mind that furosemide is a diuretic. It helps to reduce edema as well, the swelling of the body, or wherever swelling they have edema, any kind of edema can treat. So just tell them you need to know the basics, of this medication. You don't need to know each and everything. There is one more opportunity, guys, now, but not in the Osce, never mind. I was going to say with the online medication prescription that we give online, you can just click on that indications and then you can see. So if you're not sure about any medication, you can see it right away on the computer, and then when you go to the patient, you can if patient asks you, you can give them the explanation. But not in Osce. We have the inhalers, bronchodilators. We have what's in there, salbutamol, hypertropium bromide, or Ventolin salbutamol, right? So salbutamol, hypertropium bromide, or any other inhaler. So just tell them it will help you to ease your breathing, and if you have it will help you breathe more properly. That's it for the inhalers usually. And then also we did not talk about the antibiotics. That's most important. The antibiotics, you have loads of antibiotics, and then you need to know if the patient is allergic to that antibiotic or not. So when we talk about allergic reaction, the first thing in my mind, the first thing that comes in my mind is amoxicillin, or augmentin, or penicillin allergy. So if patient is allergic to penicillin, are you gonna give amoxicillin? Are you gonna give augmentin or comoxiclav? Are we gonna give? No, right? So saline we're not giving. Penicillin, allergic to penicillin, we're not gonna give any medications contain penicillin. All right, so there are 3 medications I've said already: comoxiclav, amoxicillin, augmentin, or what other medications? Furantoin, clarithromycin, metronidazole, or what else? These are the common ones only, really. Flucloxacillin is there as well. So remember that there are some antibiotics also you will get in the exam. So you need to know if the patient is allergic to that medication or not. If they're allergic, we're not going to proceed. Ask the patient if they have any allergy. So before giving them anything, ask them if they are allergic to anything, not only the antibiotics. Sometimes patients are allergic to codeine. Sometimes they come with the reaction or something containing paracetamol. So just remember, always, even you're giving just one cyclizine or one ondansetron, remember to ask them, are you allergic to anything? And then don't forget to code at the end. Like, you need to, whatever medication you're not giving, just code it at the end. You will not be penalized for not giving any medication, but you will be penalized if you have given wrong medication, if you have given wrong dose, or if you have not checked the obs of the patient and their blood pressure was low, you've given them bisoprolol or ramipril. Remember to check all these things. And guys, also your NMC pin will be in trouble. Don't let your NMC pin go away from you, because it will make you feel horrible, and then you're gonna go back. Maybe they will put you again in supernumerary period like band 3, or it's a bad experience, guys, honestly. So just take care of your NMC pin. And then if someone is asking you to sign something with them, let's say for the IV antibiotics, there is always double signature. 2 healthcare practitioners need to sign it. Let's say 2 nurses should give comoxiclav. So if someone is asking you to sign something, don't just sign it right away. Check the medication, check the time of the medication it was given last time, and then also the allergic status of the patient, because if something happens, the person who has given that drug will be in trouble, same as you, so you will be in trouble as well. So keep in mind that I'm signing it for you. I'm signing it for that particular person. I'm witnessing that it's correct. In my knowledge, it's correct and accurate, and I am happy for this person to give this medication. So you are saying I'm responsible, half responsible for this medication. So just keep in mind. Also, you will not get any CD medications, controlled medications in the exam, because you are still not, you haven't gotten your PIN. So only controlled medications such as oromorph, morphine, oxycodone, gabapentin, pregabalin, all those things you cannot sign it for. But if you get it in the exam, what you're gonna do? You're gonna tell them, the examiner, or you're gonna tell your patient that you have oxycodone 5 milligram prescribed, but I will ask my colleague, one of my senior colleague, to give it to you, because I haven't got my PIN and I'm not able to give it to you. I will escalate it to my nurse in charge or my other nurse who will come and give these medications to you. So still you need to verbalize it that you're not giving this medication, and then you will escalate it to someone else who can do it for you. Guys, with the IV medications, if you get any IV medication in the exam, same thing, you're gonna do it. I'm not competent in giving you IV medication, your IV injection, but I will escalate it to my nurse in charge who can come and give you this injection. All right, just tell the examiner or tell your patient. So just remember in your mind, guys, we are human beings, we can make errors, and in 12 minutes you will get 12 minutes for the implementation station. It's not like a long time, like you have, maybe let's say you have 6 medications and then you got only 12 minutes. You need to verbalize your prescription, right? When you do the implementation station, first thing you're gonna do is read your prescription loud, and then it will take you, like, if you're not fast enough to read, it can take you 3 to 4 minutes. So you need to make sure that you practice it at home, verbalizing the things, like the first medication is paracetamol, dose is 1 gram, and then time is tedious, or route is oral, or signature is there, blip number is there. So you just need to tell the examiner that this prescription is valid and legible before you give any medications. I've made a complete video on implementation station. If you want to go back and just have a look, that is a complete guide for implementation station. In today's video, we talked about only the medications that are going to come in your exam, and then you need to make yourself aware. You need to familiarize yourself with these medications, and to know that also that if I'm going to give this medication, what are the indications for this medication, and just to know that what kind of medications you're gonna get. It's not difficult, honestly, guys. These are the common medications that you're gonna see here, even in the wards. And then if you know them by now, if you're gonna get to know them in your exam, it will make your life much easier. when you work in the wards or when you work in the department. So I think it's good to just learn them now instead of delaying it, instead of only doing it for exam purposes. Learn them by heart, and for sure then you're not gonna make any error. So that's it, guys. When I was preparing for my OSCE, medications were a big trouble for me. I would think like, I don't know what kind of medications you will get. And then when we were trained for the OSCE, our assessors or our trainers, they gave us a list how to prepare for the medication only. And then that's what I'm sharing honestly, because it's not a long list. Like, you don't need to know each and everything. You don't need to know each and every medications. There are loads of medications in the world, so you cannot know each and everything, but these are the basics that you should know for this exam, and you should know what are the indications and all those. So as we discussed all in the video. So I hope you like this video, you enjoyed, and you found it informative and helpful. If you did, please give it a big thumbs up and share it with your friends who are preparing for OSCE. And then let me know in the comment section, if you passed your exam, what kind of drugs did you get, or if you're preparing for your OSCE, and then what are the medications you are worried about. Right? And then also, it will just this is how we increase our knowledge, isn't it? By sharing. So if you had your OSCE exam, and then just put in the comment section what kind of medications did you get, and maybe it will be helpful for the person who's preparing for OSCE, and then for me also, because I make loads of videos about OSCE. It will enhance my knowledge as well. So don't forget to comment in the section below if you want me to make any particular video about any particular topic. Let me know, and I'll try my best to make that video. And I will be seeing you soon in my next video. Hopefully you're gonna love this video. Hopefully you will love this video. It was quite informative. When I came, I was big trouble for me. So I think when you know it beforehand, it makes the life easier, isn't it? So if you think that it was helpful, please give me a thumbs up or a comment saying that it was helpful. Thank you so much, guys. I'll see you soon in the next video. Take care. Bye bye.